All right, welcome back again. We're going to continue on with our trunk muscles, and the next one on our list, we're on the fifth of the trunk muscles, and those are the intercostals. Now maybe you can figure out where those muscles are located based on the name. Inter means between, like international, means between nations, and then costals, costal is referring to the ribs. That's one of those regional terms you learned during Unit 1. So where are your intercostal muscles going to be located? They're going to be located between the ribs. So let me get rid of that one. That was the pectoralis minor. And if we zoom in here on the ribs, you can see you've got some external intercostals and some internal intercostals that are a little bit deeper. So actually, if I highlight the externals and hide those, your internals are actually quite a bit larger. They're partially obscured by the externals. So look how the fibers are running. They're running in between your ribs. So what those do, these are breathing muscles, just like your diaphragm is a breathing muscle. And as those fibers contract, it pulls the ribs closer together. It helps expand the rib cage, and it provides more room for the lungs to expand. So the more room you have in the rib cage, the larger your lungs can inflate, and that helps out with breathing. Okay, the next one on the list is a neighbor of these intercostal muscles we've been taking a look at. So right there, highlighting those, that is your serratus anterior muscle. So you have that on the right. Now over here on this side, we've got our abdominal muscles and our pectoralis major muscles left on here, so you can get an impression. Let me turn the deltoid back on as well, because if you're looking at a diagram with all of these muscles still present, then your serratus muscles are going to be partially obscured by the pectoralis major and the deltoid. So you can see where that's located. And you know, they look like serrated or braided muscles. That's where they get their names. All right, let's turn our pins on for these. And let's see, did they show up? Probably not, because I've been turning on all these other, oh, here we go, they're over here. I had this muscle highlighted. Okay, so the origins are running right along here. Those are actually connected into the ribs, the rib cage over on this side. And then the insertion point is on, you can't really see it, but it's going to be over on the anterior side of the scapula. So it's actually going to pull. There's your, you kind of see the scapula right in there that's faded. So the serratus anterior muscles actually pull forward on your scapulae when they contract. So they're pulling from the ribs over here on the front side of the scapula. Good way to think about your serratus anterior muscles. These are bear hug muscles. When you do this type of motion, they're helping you accomplish that. And so that is actually, it's kind of weird to think about, but if you look at the way this is positioned, when you contract those muscles, the scapulae are actually going to abduct a little bit. So they actually flare out like this, and they move forward. So they're moving away from the midline, and they're moving in a forward direction when that muscle contracts. And that's actually one of the opposite movements of the trapezius. So the trapezius, which does this, adducts your scapulae, and this one is causing them to move away from the midline. This is considered to be an antagonist to the trapezius because of that. All right, we're moving right along. We're going to move down into the abdominal muscles now, and we're going to cover the rectus abdominis. These are your six-pack muscles that run right along the center portion, medial portion of the anterior side of the abdomen there. This little strip of connective tissue, dense regular connective tissue that one runs right in between the left and the right side of the rectus abdominis, that's called the linea alba. So that's one of those connective tissue names that you should know. And then why does this look like a six-pack? Or in some people who are really lean, you can kind of see it 1, 2, 3, 4, 5, 6, 7, 8. It could look like an 8-pack. And so all this wider tissue that you see in between the red muscle type tissue, those are dense connective tissues that help anchor the rectus abdominis to underlying tissues and help keep it in place. Because if you think about it, look at how those fibers are running. If you didn't have those anchors there that give you that 6 to 8 pack appearance, if you're lean, think about when that muscle contracted, or if you did a sit-up. You guys know when you do sit-ups, it works out these muscles. Think about if they weren't anchored down like that with those connective tissues. The whole rectus abdominis muscle would flare up like that if it wasn't anchored down. All right, so let's take a look at our origins and insertions with that one. All right, so let me turn on my pens. Oops, let me clear all the pens. Make sure I have nothing selected there. All right, I'm going to select the rectus abdominis. Let me do multiple select here. Select both sides, and I'm going to turn on my origin and insertion pen. So there's the origin. So up here mainly along the lower ribs, that's where the rectus abdominis muscles originate. So that stays stationary during contraction. And then look where it's inserted, down here along the pubis portion of your pelvic bones on each side. So you contract these muscles, origin up here, insertion down in here. What's that going to do? So think about like when you're doing a sit-up, you are flexing the trunk. Okay, you're curving the trunk and bringing your pelvis up closer to the chest. All right, so that's flexion of the trunk, sit-up, crunching muscles. And you guys know too, maybe if you've done upper abdominal versus lower abdominal exercises, because you have those connective tissues in there, anchoring different parts of the muscles separately, that allows you can contract different parts of this muscle separately from others. All right, so then we're going to get into the 3 layers of the abdominal wall. So let me deselect all of that, and let me clear all of my pens. All right, I'm actually going to have to, the rectus abdominis muscles are actually underneath. There's an overlying layer of dense connective tissues, a sheet of dense regular connective tissue there. And so I'm going to have to turn on muscles that are called the external oblique. So let me see if I can refresh my view here. You can see these pop back up. Yeah, there you go. They came back on. All right, so this large muscle that you see here is called the external oblique over on the right. There it is over on the left. And of course the muscle portion is in red over here. And then the gray tissues that you see there, those are dense regular connective tissues that actually overlie. They're thin, but they overlie the rectus abdominis, and then they connect into that linea alba, that strip of tissue that you have there running right down the midline. All right, and then notice with your external obliques, notice how the fibers are running, across, more or less, across the abdomen. And let's turn our pen, let me highlight this side, and I'm going to turn my pens on. All right, so origins are over here, mainly along the ribs. Notice you do, and then also even back here, along these floating ribs, even back in there, you have origin. Insertion points along the pelvis, multiple places. You've got it up here on the ilium, down here at the pubis. You've got a blue marker down in there, over here. And then also over here along the linea alba. All right, so think about it. Origin over here, insertion over in here. What's this going to do? If you're contracting, it's going to pull this center portion and the pelvis in a diagonal direction back over here toward the ribs. So this muscle is helping you with flexing the trunk, but it's also involved in twisting and turning. So when you do those twist type exercises, crunches with twists, you're getting these external oblique muscles involved to help you with those motions. Also important for your posture and compressing the abdomen when you need to compress the abdomen. That's also something, compression of the abdomen is something else you do when you need to breathe more deeply. You'll learn more about that when you take Biology 202, but that's why you get those side pains, when you breathe really deeply when you're exercising, because these muscles will start to cramp because they're actually assisting you with deep breathing as well. If you compress the abdomen, that also gives your thorax, your chest cavity, more room to expand. All right, so those are your external obliques. Let me hide that layer. All right, so we strip that off, and here, this is the internal oblique. So of course, you're going to have one of those on each side. Let me hide that side, internal oblique on that side. There, of course, is your rectus abdominis there in the center. And let's show our pins. These are also going to be used for twisting of the trunk. Fibers run in a diagonal direction for the most part. Notice though, in this case, the origin is down here on the pelvis and the insertion points are up on the ribs, so it's a reverse from the external obliques. So these are going to pull from the pelvis, pull from origin down in here, is pulling on the ribs and over here and pulling that towards the pelvis. So this is also involved in flexion and twisting and turning of the trunk, but you use that muscle really more in conjunction with the external oblique on this side, and the external oblique on this side is going to cooperate more with the internal oblique over here on this side. So they do reverse type motions. All right, let me clear those pins, and now let me strip off that muscle. We're going to go deeper, and I'm going to strip that one off, and this is your deepest abdominal muscle here. You've got the transversus abdominis on each side. So you've got three layers: external oblique, internal oblique, and then the transversalis or the transversus abdominis. You can use either of those terms, and we'll turn on our pins. Origin over here on the pelvis, also up here on the ribs, so it's got lots of places where it's attached and stays stationary, and then it is pulling over here on the linea alba area. So when you twist like that from side to side, your transversus abdominis muscles are getting involved in that as well. Notice these are important for posture as well. That's why they tell you to work out your core muscles to help you with proper posture when you're exercising. All right, let's take a look at a couple of additional muscles here, and then we'll be finished with the trunk, and we'll be able to move on to the arm muscles. All right, so I've brought my thorax region back up in here, some of the muscles up around the chest again, so we can take a look at the diaphragm. You've seen this before back in Unit 1, but if I kind of rotate the body up that way, there's the diaphragm. So that's a parachute-shaped muscle that separates the thoracic cavity from the abdominopelvic cavity underneath. And let me strip off the muscles on that side. Hide. And again, there it is. You guys know where the diaphragm is already, but turn on my multiple select here. Get rid of some of these ribs and other muscles so we can see the diaphragm in there. There we go. Go away. All right, so there's your diaphragm. Separates thoracic cavity up in here from the abdominopelvic cavity below. You're getting a pretty good view on it there. Now when the diaphragm contracts, it actually gets pulled downward. It flattens out, and you can kind of see how it has that mushroom shape. Flattens out as it contracts. That gives your thoracic cavity more space for the lungs to inflate, and that's when you inhale. When the diaphragm relaxes, instead of being flat, it comes back up like this in a mushroom type shape, and that's what actually forces air out of the lungs when you exhale, because it compresses the thoracic cavity and it forces that air out of the lungs. All right, so that's the diaphragm. We've seen that before. All right, now I'm bringing up a view here of the pelvic cavity. We're going to look down into the pelvis And notice you have some muscles here on the floor of the pelvis. All of those are parts of the levator ani muscle. And the name of the levator ani muscle actually tells you what it does. It elevates the anus. And you can also tell, because it's basically down there, bottom of the pelvic cavity, guess what? It supports the organs that are located in the abdominopelvic cavity and can helps keep them from falling out through openings. And of course, as you get older, that those muscles tend to weaken, or actually after a pregnancy and after childbirth in a female, they'll weaken as well, and you won't have quite as much support there in the lower portion of the pelvic cavity. All right. So that actually concludes the muscles of the trunk. We're going to move on to our arm muscles on the next video lecture.